Hello.
Hello, everybody. This is just a test. Can everybody hear me?
Yes.
Okay. Thank you, Jason. Good afternoon. Jason, can you hear me?
Yes, I can hear you, Anna.
Okay, thank you so much.
No problem.
Dr. Jones, can you hear me?
I can hear you perfectly.
Thank you. Good morning, everybody. Thank you for joining our webinar. Today's webinar is Innovation Health IT Tools Transforming Cancer Rehabilitation. We have with us very prestigious Dr. Jones, who will be our speaker and presenter this afternoon. Thank you so much. As you know, SSAI is committed to health and health initiatives. We have partnered with various health organizations in the DC area and we are working with prestigious agencies such as HHS, NIH, and HRSA to build a synergy of health subject matter experts and people that are committed to improving government, private sector work, and working with hospitals in the area as well. Our mission is to bring science, technology, and health into the new era, which is also an emergence with AI, an emergence with cyber, and it's speaking to individuals who are very interested in taking medicine, taking the health IT to the next frontier. So we are very, very excited for today's webinar. We are very excited to have Dr. Jones speaking and presenting today, as he's doing terrific work in the space of cancer rehabilitation. So thank you again for joining our call. I am Anna Cruz. I am the health IT director at SSAI. Many of you have already interacted with me. Please follow me on LinkedIn. Please feel free to email me directly if you would be interested in participating in our webinar series, if you would be interested in participating in our in-person events, or if you happen to see me at one of the conferences in the area, please, you're welcome to come up and chat. Thank you so much. I will now introduce Dr. Jones. Dr. Jones?
All right. So, hello everyone. Thank you for joining. This is a little blurb, I guess, about my background, but I am program director of inpatient cancer rehabilitation at Emory Rehab Hospital in Atlanta, Georgia. I did my medical school training at the Cleveland Clinic, Duke University for intern year, Rutgers up in New Jersey, and also did my fellowship there in cancer rehab. Also, of note, I'm co-founder of International Cancer Rehabilitation Foundation, where our goal is to bring cancer rehab to the world. It's a shortage not only in this country but globally as well. And here at Emory, I also partner with the World Health Organization to expand cancer rehabilitation, at least into the Latin America regions. But prior to all of this, I worked 15 years at Goddard Space Flight Center as a flight systems aerospace engineer. So mechanical engineering from Purdue University prior to this transition into this new calling on my life. So a lot of you may have never heard of, oh, next slide, by the way. A lot of you may have never heard of cancer rehabilitation. In fact, when you think of cancer, most people think we need a cure for cancer. Let's beat the cancer. And it's not only the patient who's more focused on the cancer, but also the family members, friends, the oncologists, the primary care doctors. Most of the medical team are just focused on the cancer. And what often gets left behind is the patient. Everyone's so focused on the cancer. Most of us have been touched by either directly or indirectly with someone with cancer, and that has been the primary focus. But cancer affects the whole patient, not only their quality of life in battling the disease, but also the disabilities that may come from the treatments, whether it's surgery, whether it's the chemotherapy. There are a lot of side effects, and it's not only physical, but mental and emotional side effects. And a lot of people, once they're through with the battle or ongoing in the battle, they still want to have some type of normalcy in their life, including going back to work, still going to the baseball games with the kids, just having a good, normal function and quality of life. That's what my specialty focuses on. It focuses on the medical management of all of the complications for the whole patient, not just the cancer. And we often find ourselves spending a lot of time educating and connecting patients with support groups, in addition to managing the long-term adverse effects from not only the cancer, but the cancer treatments. And this starts at diagnosis. It's not just once you beat the cancer or once you start treatment, but even beforehand, there's a lot of preparation that patients can benefit from to improve their outcomes. So before, during, and after the treatments have long been concluded, there's a role for cancer rehab in most patients' lives. Next slide. So just to orient everyone, because I know this is more about cancer rehab and health IT, but it's important to understand the different areas that you're going to be addressing. So for the patient, let's understand the treatments first. So in general, treatments fall into one of these three buckets. It's either going to be a systemic therapy, which is going to be a chemotherapy, which is a drug that's going to attack rapidly dividing cells, including the cancer, but it attacks the whole patient. You know, you might hear someone say, you hope that the chemo kills the cancer before it kills the patient. Well, there's some truth to that because it is very non-discriminatory. Then you have immunotherapy, which is like trying to train the immune system to target the cancer cells. In fact, as we sit here right now, our own immune system is actively surveilling our body for cells that are cancerous and killing them. But we have therapies that can actually rev up the immune system and have it target specific types of cancer. Of course, there are adverse effects because the immune system can also attack our cells in that process. A lot of cancer therapies are hormonal, like breast cancer or testicular cancer or anything that may treat or suppress the hormones that our body normally produces that cancer cells may actually have a preferential affinity for that helps the cancer grow. So oftentimes we may suppress the hormones in our body that the cancer cells are actually using to grow. So that also has side effects. We have targeted therapy, which looks for specific molecules on the cancer cells. Again, we're all that systemic therapy. You got radiation therapy. So just like, you know, even in our spacecraft where, you know, you have radiation, high energy particles, photons going through, causing damage to the electronics. Well, within the body, those same high energy molecules or photons can actually cause damage to not only the cancer cell, but also our muscular tissue, our skin tissue, our nervous system, the nerves itself. So we may oftentimes damage healthy tissue in the process of trying to treat the cancer. And then you have, is the radiation going to be curative, as in curing the cancer, or is it palliative? Sometimes you give radiation just to control the growth of the cancer because it may be a form of pain control. So just reducing the tumor size, but without the intent to actually cure it, because maybe it's metastasized to other areas of the body and is causing a problem. For example, a tumor growing on the hip of a patient. I actually had a family member who had metastatic disease that a tumor grew on her pelvic bone, and she had significant pelvic pain. And so she would go to get radiation treatment periodically just to reduce her tumor size enough so that it can help alleviate some of her pain. And then you have surgeries. You know, not only surgeries to remove tumors, but surgeries to grab lymph nodes out of, let's say, the armpit for a breast cancer patient, or surgeries to just get a biopsy so that we could figure out what type of cancer we're facing. But anytime you go and you make an incision and you remove unhealthy tissue, a lot of times it's going to have side effects. And then there's also the reconstructive part of it. So all these things patients have to deal with in addition to the cancer itself, all of the different treatments and the schedule and the impact it places on the patient's lives, the family members scheduling, doctor's visits, etc. And it's going to bridge over into the IT in a second. Next slide, please. So I briefly talked about a lot of the complications, but here's a nice list of what I said, and this is just a very top level bucket. So systemic cancer treatments can result in neurocognitive deficits, cardiotoxicity, gastrointestinal toxicities, and we're talking like diarrhea, bloody stool, we're talking like gastric dysfunction, nausea, vomiting, pulmonary toxicity, we're talking radiation therapy or chemotherapy or some of the treatments causing the lungs to malfunction, become more fibrotic, scarring down. As you go through all of these systems, this is just more than an oncology team. These are now subspecialties, which means that this is an opportunity in the IT field, or at least for health technologies, to develop technologies that can monitor the functions of all of these different systems that are being affected. Going over to radiation therapy, we have burns, we have neurologic injury. Another example may be if you get radiation therapy, let's say for a head and neck cancer, where a patient may have a tumor on their esophagus. So you hit radiation treatment, but what's also right there nearby, you have the spinal cord. So now the spinal cord may get a little bit of radiation damage that may not initially present as a problem, but over time, the spinal cord injury, which is the information cord for the rest of our extremities, they may start developing upper or lower extremity like dysfunction, inability to control their arms. So now they're becoming more and more disabled over time. Adaptive technologies can help a patient who is experiencing these changes adjust and adapt and still remain functional, still have a good quality of life. And that's where cancer rehabilitation really finds a unique space to enter, because it's going to not only treat the patient, but also pair them with appropriate technologies as they develop. And then surgery. You have any anatomical derangement. So again, when a surgeon goes in to remove a tumor, it's not very discriminatory. Oftentimes they're taking a lot of good, healthy surrounding tissue in the process. And so that can result in, for example, if you have one of the more common is a breast cancer, where a patient is having a mastectomy, they will most likely have some of their pectoral or chest muscle removed in the process. And so now you have muscle imbalances, you have shoulder problems that can develop as a result, you have weakness, you have inability to reach overhead comfortably or even dress yourself. Eat with ease or dress yourself with ease. And so again, all of these things are affecting the patient's ability to adapt to their environment, which is a very, very good opportunity for technology to come in and help bridge that gap. Let's keep going. Next slide, please. So in rehabilitation, the treatment approach is going to be a variety of approaches, from medical management, coordinating with physical therapy, so that's ability to walk, strength, building the strength of the patient wherever they're experiencing their deficits. The occupational therapy, which is more like fine motor skills, and also more functional tasks, like not only like improving the patient's strength, but helping them develop their ability to, say, prepare a meal for themselves and maintain their independence. Speech and language therapy, again, that depends on the type of cancer a patient is experiencing or has, but it's very commonly used in patients who may have had an oral cancer or a head and neck cancer, where they may have not only speech deficits, but also swallowing dysfunction, which may also put them at risk for other complications like pneumonia, inability to swallow where some of your food contents or saliva goes into the lungs rather than the stomach, you have a lot of complications that can come from that, including pneumonia. And so speech and language therapy is very important in that sector. But then you have also the neuropsychological therapy and then social support. So all of these things requires a coordination of a pretty robust and comprehensive medical team, which can be very overwhelming for a patient who is having to go to multiple appointments, have to interface with multiple providers, have to receive data from multiple providers, order prescriptions, and also message whenever they have new problems that are occurring. So the IT space can bridge and make this coordination of not only the patient with their different providers, but also help improve the coordination of providers with each other in addressing the patient's needs. In rehab medicine, a patient typically, well, not typically, but will fall into one of four categories in terms of their rehabilitation approach. So you have a preventative rehabilitation, which that approach is more prior to treatment. If you know you're going to get, let's say, an example may be if a patient has a tumor in the liver region. It could be a gallbladder, it could be the liver, it could be intestinal, just somewhere in that region, and that's going to require some type of surgery to resect. We can work on a lot of core strength, a lot of postural training prior to the patient actually going through a surgery where the incision has to be made through the abdominal wall. Also other things like improving their overall cardiovascular fitness prior to starting chemotherapy, starting or some other systemic therapy in an effort to help lessen the complications or the fatigue that a patient may experience. And then you have restorative rehabilitation, which some patients may have a new diagnosis. They are starting treatment. They have very, very wide spectrum of treatment options available to them. So we may begin a restorative, like trying to get them back to their prior diagnosis, like fitness level or functional level. And then for those patients who have recurrence of disease, and they may have run out of all of their treatment options, well, we go more down the supportive or palliative rehabilitation approach, because even though we may not have any cure for what's their disease, is still a possibility to continue to have them have a meaningful life, meaningful function, maintain independence, and also in the process reduce caregiver burden for family members. Next slide. So what are some of the barriers that a patient with a diagnosis of cancer may have preventing them from getting cancer rehabilitation? Again, is one of the first things I said earlier is many of you probably have never heard of cancer rehabilitation. So there is, in general, across the spectrum, a lack of knowledge of the discipline. And if there's a lack of knowledge about the discipline or the specialty, then not only will the patient not know to ask for it, but their providers may also not have the awareness that, oh, there's a cancer rehab professional within our region. Many of you probably don't know, like right there in the DC metro area, if some of you are coming from there, Johns Hopkins has a cancer rehab program, so does Georgetown, and the WellStar program. And they also have a National Cancer Rehab Hospital. National Rehab Hospital also has a cancer rehab group within their different specialties. So like it exists, it's a resource that's there, but it's not well publicized because everyone always focuses on the cure. So in addition to that, unfortunately, because of the lack of, I would say, awareness, there's also a lack of policies that promote cancer rehabilitation, and that unfortunately finds its way into the insurance sector, where they may not pay for certain uh, treatments, or they may limit certain treatments, such as you may only have 3 weeks of physical therapy on your insurance plan. But if you have a diagnosis of cancer and you've gone through treatments, physical therapy is something that you're going to need most likely for the rest of your life, depending on the severity and the types of treatments you receive. And so having physical therapy 3 weeks out of the year, or physical therapy or physical therapists as part of your team, but only limited to a short window of time, is not very helpful for maintaining overall quality of life. And so that's where, lack of government support, policy, funding restrictions play a role. And then you have patients with diverse needs. They require very personalized care. And so everyone's unique, just like their fingerprint. They have a different financial situation. They have a different home support, social situation, different jobs, very disease-specific disabilities. For example, a patient with stomach cancer is going to have a very different overall need for maintaining function than a patient with, let's say, a brain cancer or a breast cancer. Although a lot of things may overlap, it's still, their treatment needs to be personalized. And so the devices that they may need, or the access to information or coordination of their care team will also be very unique to their specific needs. So however we bridge that gap needs to also be adaptable. And then also a lack of, I mentioned the patient provider, but then the challenges in monitoring and managing patient progress. And so, I mentioned earlier, and I kind of throw in a few examples. If you have a patient with let's say a chemotherapy that had a side effect of a cardiotoxicity side effect, and let's just say for this specific patient, who may have had like a lung cancer and they got radiation therapy to the chest region as well as chemotherapy, the drug that they receive may also cause irregular heartbeats. Irregular heartbeats can cause blood clots to form, which could form and then travel to the brain, which could cause a stroke. So this is like a long cascade of things that can happen. Well, what about heart monitors? Wearables that patients can use to help monitor, to say, oh, my heart is not beating appropriately. It's putting me at risk for developing these blood clots that could travel to my brain, and it needs to notify a provider. So like barriers, like monitoring that real time is something that's not universal, but it's something that the health IT space can help bridge that gap to, as well as managing patient progress, like the physical therapy program that a patient may be on with their home exercise program, like monitoring how they're performing, and then also relaying that information in a very succinct and manner to the providers is going to be crucial going forward in this space. Next slide. So this is not only a problem within the U.S., but this is a global issue. Cancer is non-discriminatory. It's worldwide. And I mentioned earlier that I formed the International Cancer Rehab Foundation, co-founded it with one of my colleagues, Dr. Presno, Deanna Presno, and Michael Stubblefield, who were at Kessler Foundation, which is in New Jersey. But what we're finding is that globally, not only is this knowledge of cancer rehab pretty minimal in the U.S., but it's even more of a drought of knowledge with providers around the world. And so what we've done is actually started routine workshops and conference calls and case reviews to review cancer cases with our colleagues in Mexico, in West Africa, in South Africa. And we're starting to form partnerships, and we're using video conferences. We're using things like Teams, like we're talking now. I'm in Atlanta, you're in wherever you are currently. But we're also using that to help bridge the gap and share knowledge across the globe on how to care for patients who are going through their battle with cancer. And so there's more opportunity there because let's say we have monitors that we can monitor patients globally when they travel. Like there's a large space uh, in the cancer rehab sector because we're trying to get patients back into a functional quality of life where they're out back in their environment in society doing the things that they want to do, but they need a little bit extra reinforcement and resource to help make sure that their health is at optimal level for whatever they're doing. So I think, uh, Anna, maybe you may have some thoughts additionally that you would like to share in this space as well.
Yes, thank you so much. So, in terms of cross-border collaborations in health IT and research development, there are health challenges that we are facing. Cross-border collaborations are actually improving that, especially as countries share data, expertise, and resources. It drives breakthroughs. A great example is the partnership between the US and Europe health agencies working together on AI-powered diagnostic tools for early disease detection. I'm sorry, I'm getting over a cold. I apologize, everybody. By pooling research efforts, they can develop solutions faster and move effectively, benefiting patients worldwide. This is imperative that as we move forward, we collaborate with other nations, we collaborate with Europe. AI is making it easier. As you know, we've also had a series since the summer discussing AI, the benefits of AI, but also the importance of including cyber um, protections as we're moving forward in the AI space to basically create a global synergy where we're partnering with other countries to improve health overall. And that's one of the biggest benefits of health IT is how do we move forward? How do we move forward with AI, with powered tools, but also keep data protected for patients? Another interesting point is the case studies of global initiatives in cancer care. When it comes to cancer care, collaborations across countries has led to some truly inspirational success stories. Take the Global Cancer Moonshot Initiative, which SSAI actually was part of, and we are really excited to be part of the NASA initiatives and NASA Health as well, and working in collaboration, not just with health agencies, but also with NASA. Which brings together researchers from different countries and share data and best practices for personalized treatments. For example, in India, affordable cancer screening programs which leverage AI and mobile health units to research rural populations. It has created a massive improvement in how people are scanned, the affordability and the access, especially in extremely rural areas of India. That can also transfer to areas in Latin America. It can transfer to areas in Africa. There's organizations that would benefit from being part of initiatives that are working with AI and are working with data scientists to further engage and build a community of information. So basically, a tool that was used in India can now be used in Morocco, and you can reach that population. You can use it in Sudan. So it's just a matter of educating, it's a matter of accessibility, it's a matter of being able to work together globally and finding proper partnerships that would be able to take us to the next level, would be able to leverage cost-effective tools that are accessible. And that's the great thing. We don't have to be scared of AI. We don't have to be scared of tools because that tool can basically open frontiers and can open spaces that weren't available before. But once again, we also have to be cognizant that we do need protections and there has to be an alignment between the programs and the tools being developed and how we also gather the data and how we protect the data, not just for the different countries, but also for the patients. So at a micro and macro level. So by addressing those disparities and fostering collaboration, I believe that health IT can help and foster a global change. So I'm pretty excited about the future. I'm pretty excited about the tools. I'm excited about doctors um, that are looking to bridge those gaps, such as Dr. Jones, who's doing terrific work in cancer rehabilitation, but also with his foundation, and also trying to bridge not just on the United States frontier, but also across the globe, and working with Latin America, as he mentioned. Okay, next slide, please. Okay, empowering health IT solutions. Wearable technology monitors are essential nowadays. Physical activity and fatigue can be monitored with wearables. Wearables are like having a personal health coach that's always with you. You know, we use our smartphones. We also use our tablets. We use our phones to track how we're walking, our pace of our heart. They track everything from like the heart rate, sleep patterns, to daily steps and even fatigue levels, helping patients and doctors stay on top of progress. For example, watchables can alert rehab specialist if patients' heart rate spikes during physical therapy, allowing for real-time adjustments to prevent overexhaustion and speed up of recovery. This is phenomenal. So it's also a tool not just for the doctor, but for the individual, and the individual has greater access to control their health and control and make adjustments to their everyday life. Now, the AI-powered tools customize therapy plans based on real life and real-time data is essential. AI is changing the game when it comes to personalized care. Instead of one-size-fits-all approach, AI is now driven by analysis, real-time data. Um, Therapists can make adjustments on the spot. They can also create new plans. They can also adjust the therapy. They have greater resources and data to go to the insurance companies, which is a big thing nowadays, right? Insurance. How do we get our patients approved? And doctors have that hindrance in terms of that my patient does need this, and I have to draft and write these documents to try to get the minimal um, the minimal treatment approved. But with AI, with powered tools, you can have it automate and track, and so it would facilitate the process for the doctor to submit that approval request, and it maybe expedite the process for processing, expedite the process for that person to receive care at a faster rate, which is especially in the cancer realm. My brother passed away 10 years ago from cancer, and he was just 24, and he had stage 4 cancer, and it happened so quickly within months. And he went to several doctors, and no one knew what was happening. Had there maybe been a collaboration between the different doctors and or additional tools 10 years ago, maybe, it could have been detected. Also, the insurance claim could have been, the insurance process could have been adjusted so that he was able to get access or approved for additional MRIs or scannings that weren't done in time, and he passed away. So for me, this is a very sensitive subject, but it's also something that I'm like very passionate about. And I think like if you can save one patient with a tool, or with faster processing for paperwork, and that alleviates the restrictions for the doctor to create and a health plan and or a treatment faster, I think that's something worth us looking into, and pushing forward and working with government agencies and advocating for with our, congressmen and people that we need to have access to. Now, VR and VR applications, enhancements in therapy and managing of pain. Virtual and augmented reality aren't just for gaming. That's the interesting part about working with disease and or cancer. You can use these new tools to kind of further move the rehabilitation and move the treatment along. They're transforming rehab. VR can image patients in engaging environments that make therapy sessions more interactive and even fun, which can improve motivation and endurance. For example, stroke patients using VR, they can have more of a moving arm. You can make, for example, create the simulation, and they can have more mobility in their arm, and you can create a faster simulation of real life activities as you're going through the rehab stages. You can create the functionality in terms of the exercise, like in the kitchen, this is how the person's body would function, this is how they would move, and this is how we need to create the tool, the arm, or how the leg, things of that nature, or how we adjust the the equipment to their bodies. It's really interesting if you haven't had the chance to look at images or how VR is being used. There are plenty of videos on YouTube that you should like take. If you have an extra 10-15 minutes today, you should look into it. It's really interesting. There's like a lot of advancements being made. So that's something to think about, and just in terms of where we're headed. Um, AR can guide patients through exercises with visual overlays, reducing the need for constant supervision and helping them stay on track. These technologies aren't just futuristic concepts. They're current, and as I said, they're on YouTube. They're also being implemented for rehabilitation centers. I believe that John Hopkins in Baltimore is already starting to implement them. I know that University of Maryland here, also in Baltimore, is also trying to bring it into their program to kind of test and see how they would merge it in the future for like training purposes, and also just for rehabilitation of serious spinal cord injuries. Next slide, please. So, patient portals for tracking treatment plans and progress. Patient portals have completely changed the way we manage our health. They give patients an easy way to stay on top of their treatment plans, track their progress, and access important health information every day, everywhere. It's all about giving people more control and transparency in their healthcare journey. Telemedicine platforms for remote consultants. Now, this one is really important because we're moving more towards remote consultations, but then also consultations are very limited in terms, like for instance, I had one yesterday, just for the flu, and prescriptions aren't allowed to be processed online, but you can talk to your doctor and they can recommend remedies or going to urgent care. Um, so, it is limited, but what we do have seen is telemedicine has become a game changer, especially in the past few years. Whether it's a convenient and no more long commutes and waiting rooms, there is that convenience. However, as I mentioned, it is still very limited. It is very much for just minor inflictions and illnesses, for the common colds, or for example, if you want to have a follow-up in terms of how you're doing after you've sprained your knee or something like that. So it is limited, but it is helping, especially during flu season. You can have that interaction with your doctor. ML-driven tools for predicting recovery and customizing innovations. Machine learning is making healthcare smarter by making providers predict recovery timelines and tailor treatments to each person's unique needs. This is essential. This is where we're headed. However, the one thing is we need to remember that each provider has different tools. Within network, out of network, there might not be sharing. So data is still can be a bottleneck. For instance, if you're going outside your network, if you're staying within your network, the other issue is if, for example, if you're going to MedStar, but then you're going to John Hopkins for another specialist, or you're going to suburban hospital here in the local area and they're not sharing information, that can be a hindrance. It's a bottleneck. So there are tools and there's customization and prevention, but there has to be also a unique way where different inside your network and outside your network still is able to share the information, is still able to share your treatment. If there is an emergency, if you are, for example, if an ambulance is called, there should be some in the future, in the next couple of years, there should be some form where the person that comes in and treats you is able to get your medical history at a faster speed, maybe with a small wearable tool and or just inputting your information. I think that has been one of the issues in terms of, okay, so we're moving forward and we're creating, within your network, within your space, within your doctor community, we're creating this information. But if you happen to be outside or you happen to be on travel, if you're a consultant and you happen to be in another state, that also happens to be an issue currently, and it's an ongoing discussion. So there are things that are being customized. There are things that are preventative, and healthcare is becoming more customized, but also we need to determine like how we're going to work within like the network, outside the network, and also how data is going to be shared and the protection around that data. Next slide, please. Okay. Bridging physical and digital rehabilitation. So enhanced prosthetics for mobility support. Technology is really transforming mobility support. Enhanced prosthetics are giving people newfound freedom, whether it's helping someone walk again or improving their day-to-day mobility. These devices can even adapt in real life, allowing users to move more naturally and confidently. For example, stroke patients using robotic skeleton have been able to move and regain mobility faster, cutting down their rehab time significantly compared to traditional therapy. Now, the Internet of all things, right? Enable devices for home monitoring and updates to providers. Imagine having a health assistant right in your home, smart devices that monitor your health in real time and share updates with your doctor, whether it's tracking vitals or managing chronic conditions. Devices make it easier to catch issues early and stay connected with healthcare providers without extra appointments. A great example is smart wearables that monitor heart rates and activity levels, helping rehab specialists adjust treatment plans remotely, which can speed up recovery and reduce hospital visits. Integration of devices with centralized health systems, which is what we were just discussing in the previous slide. The real magic happens when all these devices work together within centralized health system. It means no more fragmentation of data. Providers can get a complete picture of patients' health, leading to better, more informed decisions and truly personalized care. For instance, integration data from physical therapy wearables into centralized systems allows clinicians to fine-tune rehab exercises in real time, ensuring patients to stay tracked and recover faster. these advancements aren't just cool gadgets. They're saving lives. They're creating a more accessible world. They're creating a cost-effective world because the by reducing the number of visits, by reducing the number of just times that you need to be in front of your doctor, um, you're cutting down on cost. So this is one area that, again, insurance, one of the main factors when discussing in insurance, discussing healthcare, discussing things as health and cancer rehab is insurance and the approval method. By creating wearables, by creating devices, by creating AI that cuts the doctor's time in terms of filling out paperwork, but also um, gives them the data they need, and they can just push, a button and get all the raw data of the patient and make informed decisions. That really does help, and it does cut the cost. And again, the hope is for patients to be approved at a faster rate, to get accessibility to their doctors, to the medicine they need, and the therapy they need. So these are all good things. Next slide, please. Okay, so what's next for health IT for cancer rehabilitation?
Yep.
Um,
Oh, sorry, I was muted. I was thought I was unmuted. So
okay.
if you don't, so yeah, what is next? First, you have expanding remote monitoring and personalized care. So I mentioned earlier, cancer can affect any part of our body. So the future of cancer rehabilitation is all about meeting the patient's needs where they are. So remote monitoring tools like wearable devices, smart apps, those things will continue to evolve as our technology improves. But tracking the patient's vitals, symptoms, the recovery progress in real time is going to be very important to help continue to personalize the care and the treatment plans, as well as the therapy plans for the patient. For example, a cancer survivor could recovering from a treatment could use smart watches to monitor their heart rate, sleep quality, physical activity. All that data could be sent directly to their healthcare team for more personalized support. And this kind of continuous care can help detect issues early and adjust the rehabilitation plan as needed. Additionally, it can be used for screening or to identify very life-threatening events. AI is becoming a key player in the rehabilitation by analyzing like vast amounts of patient data to create tailored recovery plans. So like imagine an AI system that can like look at a patient's unique treatment history, their side effects of those treatments, and the capabilities of the patient to recommend the best rehab exercises and lifestyle adjustments so that the patient can have a good quality of life. We're already seeing AI tools like help predict which patients are at higher risk of treatment-related fatigue or some other dysfunction, and even enable like proactive interventions just to speed up the recovery and improve quality of life. And also, Anna mentioned earlier about virtual reality. It can revolutionize how cancer patients regain strength and manage pain. VR therapy programs can immerse patients in engaging environments that encourage movement and relaxation. They could be very therapy-specific environments. For example, if a patient has a brain tumor that affects the cerebellar region, they're going to have like gait dysfunction. They're going to have frequent falls. We can have a VR environment that actually a patient can immerse in to train and improve their balance. In fact, at Walter Reed Hospital, not too far, right outside of the district, a lot of their patients are military veterans who have traumatic brain injury from explosions or vehicle crashes, and they oftentimes have gait and balance issues, and they use actually a VR environment called the Karen. You can look it up on your own time. CAREN. It's like an integrated treadmill with a room filled with like infrared sensors that a patient that's on a I think it's a 6 degree of freedom move table that can change the environment so that the patient can simulate walking through uneven terrain while improving their ability to maintain their balance. So these kind of environments are already in the works and have been for quite some time, but they're not universally available for all patients, and we have to change that. And then also advancing data interoperability for seamless care is I think paramount. Like we're in this information space, like we're always getting inundated with commercials and Instagram posts and TikTok for however long that's going to last. I don't know. But as patients receive care from multiple providers, they're also getting chimes in from different providers on their patient portal, on their phone apps. And if you have multiple different platforms, that can be overwhelming for the patient. So ensuring seamless data sharing, not only to the patient, but also between providers is going to be very crucial. So in cancer rehab, we'll focus that health IT in cancer rehab should focus on integrating data from different sources, because we have to integrate as a cancer rehab specialist with a very diverse therapy team. Also the patient's other specialists, their oncologist, their radiation oncologist, their surgeon, their primary care doctor, and then depending on what toxicity they may be experiencing from their cancer treatment, maybe they're nephrologists, maybe they're pulmonologists, maybe they're cardiologists as well, all coming together in a bundle of information to help make the patient's quality of life better. And so having that data be seamless and shareable with ease is going to be very paramount to helping improve patient overall outcomes. So by embracing all these innovations, like cancer rehab can become more personalized, more proactive, and accessible not only within the US, but around the world, and help patients recover faster, help them have more meaningful life and more healthier lives than they ever could have had before. Any questions from there? Oh, next slide, I guess.
If you have questions, please submit them in the question section or in the chat room, and we'll be more than happy to answer the questions. I'll give everybody a minute or two to submit their questions.
Let me see if I can look on the chat. So what role? Oh, so we kind of mentioned that. I can revisit that one. So what role does virtual reality play in cancer rehabilitation, and is it widely accessible? So VR, and again, this is going to be tied to the dysfunction a patient may have as a result of the cancer. But it can have a significant role. In fact, I'll even take it a step farther. It can have a role in anyone's life that has any type of deficit. So let's just say, for instance, you have a patient with a brain tumor or a stroke or a traumatic brain injury, anything that injured the area of the brain that controls upper extremity motion. So we're talking arms, hands, and a patient may have been a bus driver and prior to wherever this insult is. And so not only do they want to have a normal functional life, but they have to feed their family. And so the question now becomes, can they drive again? And it's one thing to play video games with a race car game, but can you actually simulate the environment for a bus driver safely? The bus itself, the handle where you open and close the door for the patrons getting on and off, the overall cockpit, all of those things can be simulated at a cheaper and safer in a cheaper and safer way that I would say prior to VR, a patient with those types of conditions might not even have on the table the opportunity to can they go back to work as a driver. So it's not widely used. Is it accessible? I would say the technology is there. But are the resources there at rehab hospitals across the country? The answer for that is no. They're just not as readily available as they should be. So we have work to do there. And there's a lot of fertile ground for growth in providing those things more universally. How can AI improve the personalization of cancer rehabilitation? It's funny because I feel like I'm repeating, but cancer is very non-discriminatory. So the deficits are going to be a function of what type of cancer the patient has. And so the beauty of AI is that it can actually interact with and learn from patients. Can it improve the personalization of care? Sure. If you can use the tool to identify the patient's very specific deficits, whether it's not only a physical or functional, but also what other social or financial or cognitive or psychological deficits or problems a patient may be experiencing. AI has a very unique place in that it can actually help to identify and synthesize a very comprehensive treatment plan that would need, significant fine tuning, but perhaps it could get to the point where it can actually lead that consolidation of the care or that personalization of the care, because you can just continue to add more variables, and as it learns the patient, it could actually potentially, one could argue, potentially outperform the knowledge of the physician itself. It has done so and proven so. So who knows where the future lies with that. But yeah, it can improve. Any other questions?
All right, thank you. Thank you, Dr. Jones. So with that, we conclude the presentation for today. I would like to remind everybody on the call that we do have an in-person event on February 6th in Bethesda. It's at the Embassy Suites, and just so everybody knows, there is a breakfast included. It's free to attend, and parking is also free that day if you're part of the event. I would like to invite everybody. Please share the information. We'd love to meet everybody within the community. Also, we do have a series of webinars, as you know, so we will continue to have the webinar series, and we will have the next one in February. I will send out the invitation for that webinar this week as well. So thank you so much. If you have further questions, if you would like to also ask Dr. Jones additional questions after the webinar, please, you can send me an email and I will direct it to him. And or if you would like to hear more about the work that he's doing, the work that he's doing with the foundation, please let me know. I will be more than happy to share the information so you can support the foundation and what he is currently doing and the space of cancer rehabilitation.
And
Thank you
also,
so much.
I'll just
Yes.
add, because I meant to add my contact information on the presentation, but I'm on LinkedIn, Noble Jones. You could also email me at noble.jones@emory.edu. And so if you want to share that, Anna, with the group,
Yes.
like I'm open. Because who knows, you may have a family member or you yourself may need someone because you're facing a diagnosis of cancer or you're a survivor and you want to get connected with resources that can help you improve your quality of life. So I'm here to help. That's why I changed from engineering to medicine, because I want to help people. And You in health IT can do the same thing as well. But reach out to me. I'm here.
Thank you so much. I really appreciate your time today and all the valuable information that you've shared. So we will be sure to follow up if we do get any inquiries and direct them to you. Thank you so much, Dr. Jones. With that, we conclude the presentation for today. Thank you, everybody. Oh, by the way, it will be shared on LinkedIn and it will be shared on YouTube. So if you want to, if there's something that you want to go back and listen to, we will have it on the SSAI YouTube page and we will also post on LinkedIn. Thank you so much, everybody. Have a lovely Wednesday.
Thank you.